Okay, welcome back, everybody. We've got Teresa here and just a wealth of knowledge and information.
My name is Tersa Kennens. I've been a physical therapist for 26 years. I began treating pelvic floor dysfunction in the early 2000s, and it was during that time that I got really interested in how the body holds trauma, holds stress, or holds anxiety. Several of my classes were on visceral work, and they talked a lot about cellular intelligence and cell memory and tissue memory. Before this, I always wondered what the emotional connection was with the physiological or muscular sort of holding patterns that a lot of times we found. And it was often a conversation with physical therapists is why are there some people who have had muscular problems and have a whole host of other things that go along with it? And why do some people just have muscular problems and injury and they're fine and they function afterwards? And so combining some of the visceral work, how much trauma we hold in our body and in our organs and in our tissue and even in our posture. There's multiple times that they would say in the class that and there's further studies on this, but our large intestine is our second brain and our liver is our organ of being, which is very Eastern medicine-y. But when you start talking to patients about where they hold their stress, if they have a pit in their stomach or they have a tightness in their throat, then oftentimes we realize that our organs hold trauma as well as the rest of our soft tissue. And so I became much more interested in studying how the body keeps the score and how the body holds onto trauma. And I can't tell you how many times when patients are in my treatment room and my hands are on the patients that they just explode, kind of like a hairdresser or bartender, where the patients just talk about their life trauma, their current stressors that they have, their husband, their daughter, their mom, their whoever, the person that might be giving them a hard time. And afterwards they'll say, I feel so relaxed, and I don't know if it was what you did to me or the fact that I get to just talk to you about all the things. And so I've often teased with them about doing double charges for physical therapy and for psychotherapy as well, which I'm not qualified to do. But that's kind of what got me interested in doing body work and being able to put my hands on people's body and affect how their tissue moves and how their tissue gets nutrition, how to come out of some of the movement patterns that they have, and even helping them with bowel movements. When someone comes in and says, I pooped after I saw you last time and it's been so long since I had a great bowel movement. So we affected the muscle part of the pelvic floor, but then also the motility and the mobility of the intestine as well. So that's kind of the background of how I kind of got into doing body work and physical therapy.
And just something exciting. So actually want to start with the backstory of how in the world we came to get to know Teresa and this kind of budding idea that we've been working on for some period of time now. And really what we want to be able to say is use my story, because when you guys are here doing your cohort work, you learn that our story is never just for us. Our story is always for someone else to hear, because there's some beauty in that story. So let me just share my story. I got into just a phenomenal rollover car accident, chest tube, and just a bunch of other things with broken ribs and whatnot. But I developed this like numbness in my left arm and this tingles and pain. Got pretty desperate. So I reached out through connections to Teresa as a physical therapist and said, help me please, I'm losing my mind. And through that discussion and through treatments that we've done, it really started to make a whole lot more sense as I got to know Teresa's background and experience and interest in this body work and how our body holds the score. And in both of our disciplines, in clinical mental health and in physical therapy, we all learn this bedrock idea that trauma is in the body and it's stored and you can work on it. So I'm going to cut over to Teresa here because I want us to just have some story time about needles, body work, trauma.
A little bit of a background. So people will ask the difference between dry needling, which is what I do or physical therapists usually do, and acupuncture. And I have not studied acupuncture. I know that there's a lot of great things to acupuncture. It's a little bit different, the dry needling that we do. We do use acupuncture needles. However, we are looking for a physiological response of the muscle at the site that we're putting the needle into. And a little bit of background behind the needles is they've done trigger point injections for a long time, and there's been trigger point or pressure points or acupressure points for a long time that have dealt with chronic pain, because that's where a lot of times the tension from the muscle, where the motor point of the nerve goes into the muscle to tell it to go. And so people started asking questions, why do needles help with muscle tension? And so there's several different ideas, but they did a study where they did a dry needle, a wet needle, or one with lidocaine in it, and one with saline in it. And so that was the study that they did. And all the people who left, who got needles, which was everyone, said, it feels so much better. Okay, well, the common denominator is putting the needle in there, right? And so the idea behind it is that it helps to clear out some of that electrical impulse from the motor neuron or the motor point in the muscle. So from a bodywork standpoint, oftentimes when people have muscular guarding and muscle holding and tension from stress, anxiety, trauma, any of those sorts of things that people deal with, we live in a guarded sort of position, and that muscle doesn't know that it's not supposed to be guarding anymore. So it's sort of a typical definition of PTSD. It's an abnormal response to a normal stimuli, and so the muscle goes back into that sort of guarded scenario. What the needles do is it helps to sort of reset or reprogram that motor neuron point so that the muscle learns how to be able to be calm again.
Ooh, okay. So I love that, just that little bit of concept that we're working on right now, where this muscle is guarding and it's protecting something. The something, let's say its origin isn't here currently, but it's still there doing its work. And we have a lot of parallels now in the different models that we use in therapy here, where we're saying very strategically, there's an operating system that was built because of that thing that happened. And here you are playing that thing out 30 years later. And I can just distinctly remember when you were needling in different parts of my neck and shoulder and traps and lats, and the muscle would like twitch. Whoa. And then I could just feel that whole thing just relax. And then I was like, wait a second. If I was a client and I said, I carry all my stress in X, and if we leave that whole part of the body unattended, and you resolve a cognitive processing and a belief structure, but the body has kept the score and keeps you guarded, we've left a stone not turned.
Correct. And that will continue to have that firing process, even though we've dealt with the reason why the firing process was there in the first place. So that allows the body to be able to open up and be able to not only heal and recover from whatever happened a long time ago, to now be able to move in a more healthy way.
Yeah, so moving in, is it a functional question, or is it, when you taught me how to really just posture myself with the computer, like just even the little things that make such a profound difference in my life. But then thinking back to our clients who come to rebuild, and they're coming for a 1 to 2 week intensive cohort. So they're here and they're working on lots of things. But we have these days and these, let's say, these slots in their program where working the body fits perfectly within the cycle and the system that they're in as they start putting down these old ways. And maybe you could speak to that idea of we're putting down the old way and we're going to do something new because we can.
So I'll speak on the posture, because that is a very prominent sort of thing in most people, but especially people who have chronic pain. So posture, oftentimes, posture is a habit. It's usually a bad habit. So if we're used to being in a guarded posture or a closed posture or a fearful posture or an anxious posture, and then also we sit at computers and on our screens and on our phones, whether that be distraction, whether it be calming down and unwinding, whether that be disassociation, whatever you want to call it. But if we're in these guarded postures and these prolonged postures, being able to get the connection of what's causing those guarded postures, and then freeing those postures from a tissue standpoint. If we don't free them from a tissue standpoint, we can't also reprogram them. So once we can free them, then we can teach the body how to be in postures that don't cause continued tissue damage or tissue poor healthy habits. As a, for instance, oftentimes I'll correct someone's posture and say, this is how you should be sitting or you should be standing, and they're like, oh, that doesn't even feel normal. Or have them stand up against the wall with all of their postural muscles engaged, and they go, I feel like I'm standing on the edge of a cliff. And so if we've been in this guarded posture for so long, our joints and tissues and ligaments don't even know where our new posture is supposed to be. So we can't reprogram it if we have shortened tissue relationships. So we have to address the tissue and then reprogram from a postural standpoint.
One of the models we use speaks a lot to confidence and clarity, both also compassion for self. But if we're trying to, let's say, adopt a more confident position, and good open chest breath, the shoulders back and we're relaxed and we're portraying this confidence from within, but the body has no idea what that is, and actually it elicits this danger because it feels like you're on the edge of a cliff. Mm-hmm. So if you track that, then what we've just said under normal therapeutic models, the clinician has just asked the client to do something that provokes a fear response, but it was guised as, this will help you.
Right.
And then here we are in this next version of a shame spiral saying, well, I can't be calm.
Right. Especially for holding that posture. Trying to hold a posture in an unfamiliar sort of category or position, then that can take us back to that fear that we have been living in for a long time.
Yeah, it's one of the things we do here is really kind of reconnect the heart, mind, and body. The greatest threat detector of all time. That was given to us, and man, how many of our bodies have we just ignored and just having the ability to kind of reset everything? Such a powerful, powerful gift. Man, being able to have all these parts work together so that you can regulate, such a key phenomenon that we get to experience here with our clients. I love it when we sit in these sessions and these trauma sessions that we do with our individuals. Man, you can see the tension rise when we hit something, but then you also see the release and how freeing it is. And I know through my experience, man, I feel it leave my body. And I actually feel it leave out through my body. And so, again, it just speaks to, what we're trying to accomplish here with all these different facets of our program to make sure that you're healthy, all the way through.